Hi, my name is Annie Lee, and I'm a psychotherapist here at Choices, and we're happy to offer an adolescent and adult program for eating disorders. Eating disorders is commonly seen as affecting primarily young white females. However, over the years, we've seen eating disorders occur in both men and women as young as 6 and 7 years old throughout the lifespan into the 60s and 70-year-old population. So it's no longer just a disorder that affects young white females. It also crosses cultural, ethnic, racial lines, as we do see it in Latinos, Latinas, African Americans, as well as in the Asian population. And it also crosses all socioeconomic lines as well, as it's no longer seen in just highly affluent people. There are three primary types of eating disorders. They are anorexia nervosa, bulimia nervosa, and binge eating disorders. Anorexia nervosa, in brief, is an eating disorder that causes the person to restrict their intake. So they're either restricting the amount of calories they're eating, the types of foods that they're eating, and are becoming very rigid in the way that they approach foods. Oftentimes they have ritualistic behaviors with their eating, and this helps them feel in control. In bulimia nervosa, the person engages in binging and purging. Binging is eating a large amount of food over a short period of time, feeling very out of control. And this follows some sort of compensatory behavior, such as vomiting, using laxatives, diuretics, or overexercising to compensate for the food that they just ate. And this usually occurs at least 2 times per week over a course of 3 months to be considered someone with bulimia nervosa. The third type of eating disorder is binge eating disorder, where a person, like with bulimia, will binge on a large amount of food over a short period of time, at least once a week. However, they are not going to engage in any compensatory behaviors. So those are the 3 primary types of eating disorders. There's also one that's called EDNOS, which is kind of the catch-all for people who have eating disorder symptoms but aren't falling into the exact classification of anorexia or bulimia or binge eating disorder. Oftentimes people think that eating disorders is just about food. It really isn't just about food. It's more of a symptom of deeper underlying problems that someone has, and they're using food as a means of coping and feeling in control. At Choices, we address the underlying issues to help the person learn what is triggering their eating disorder, as well as helping them resolve those issues and to learn healthier coping skills at the same time.